Barrie Health Center has been here in the community for more than 40 years now. It's a rural community, at least by Massachusetts standards. Our patients prefer to get their care with us rather than going into the big city whenever possible. And unfortunately, it's a pretty good drive to any of the local community mental health centers.
We provide care for everything from prenatal care to end-of-life care and everything in between. And because of the community we're serving and the fact that we're in a community where there's no emergency room nearby, we also have a robust urgent care function. Within family medicine, a large percentage of patients come in with medical problems that have a large behavioral health component.
In the leading 10 causes of mortality, for example, pretty clearly 8 or 9 of those are tied directly to behavior. Behavior is the thing that leads people to get sick, or once they get sick, they need to begin to modify their behavior in order to improve the outcomes.
Good morning, Barrie Health Center. This is Carol.
Family physicians in particular tend to be very open to having psychologists on the team. And I find myself, in a lot of really important ways, being treated as an equal. I'm a member of the same physicians group that they are. I receive the same benefits.
He should be able to control this himself.
I'm in the same meetings. I'm involved in making the same decisions. There is a real opportunity for psychologists to be treated as equals when they come into the primary care settings.
It's not like there's the group of family physicians and then there's
an add-on.
Yeah.
Yeah.
She is a part of the meetings every month. She does contribute. And anything behavioral health is channeled through Dr. Connell. And it doesn't have to be emergencies or significant illness. Sometimes it could be somebody who's going through a slump, just needs counseling.
Life is a struggle for a lot of people. And the more support we can give them, the better they do with their life, the better they do with their chronic disease management, and the better engaged they are. And having that resource available just makes that so much easier, makes us more efficient, and provides them with a better level of care.
This has been my provider for over 20 years. I know the care that I get here, and I trusted knowing that it was someone here and that I didn't have to go into the city or start with someone new.
When a physician has a patient walk in and the physician identifies them as someone with an unmet mental health need or substance abuse need, they can come knock on my door or call me on the phone and ask me to step in.
One of the benefits is being able to address things while there are a concern, while people are ready to make a move. When you raise something with your physician and you say, this is really hard, I don't know what to do about it, or I'm really struggling, the chance to do something about it is best at that moment. And the chance goes down over time.
Patients come into our health center, and you can't tell, looking at our patients in the waiting room, who's here to see whom. They might be here to see a doctor, they might be here to see a psychologist. They're not going to a different building for their mental health needs and their physical health needs. The stigma goes completely away. Thank you.
Being able to hand off to a psychologist on the team who can maybe spend a little bit longer with them or help build on what they're doing with the physicians can help the physician then get to their next patient.
We raise each other's skill set. I learn a bit more about medicine every day, and you learn more about mental health every day, and it's enhancing both of our skill sets.
Yep.
I fell in love with primary care very early in my career as a psychologist.
I was able to briefly glance at the note from your last visit, and it looks like there's some concern about...
We're moving much closer to how people experience their own health and wellness, as well as their own disease processes. And it's more than just sort of the technique of how to deliver care in this way, but conceptually how to get everybody on board working as a team to take care of people in this way.
So it sounds like in the last visit that you had, Dr. Earl suggested that you increase
what's available to me to understand the person sitting across from me is so much more extensive in terms of having their medical record. You have so much more context, and you have a team to work with.
A lot of our work is pretty isolative, so to be able to share notes and share ideas, and the learning is bidirectional.
We can see each other's notes. We can communicate within the record through a task or a note pretty readily.
We can make sure that the patient's getting a consistent message from their two primary longitudinal providers that you can't get if you're not integrated.
When you look at the value proposition, it saves you money in terms of better outcomes, in terms of less ED visits, less hospitalizations.
I think we provide great care in our practice, and I think having behavioral health readily available is a big component of that.
Good primary care is good primary care, and integrated primary care is really good primary care.